Microcephaly is a rare defect that affects 2 to 12 live births for every 10,000. Microcephaly is when a baby's head is much smaller than that of a normal head size. The baby's head is smaller because their brain didn't grow properly in the womb or stopped growing after birth. There is also severe microcephaly where the baby's brain is much smaller than that of a normal size. A healthy baby's head should have a circumference of about 13 inches and should continue growing while the brain develops into the mid-20s. There are many debated causes of microcephaly. The most recent known cause of microcephaly is when a pregnant mother contracts the Zika virus. The Zika virus is transmitted through a mosquito bite of a mosquito that carries the disease. However, there are many other factors that may cause microcephaly. Some infections that a mother contracts during pregnancy can cause microcephaly, like rubella, toxoplasmosis, or cytomegalovirus. This defect may also be caused during pregnancy because of severe malnutrition, exposure to harmful substances like alcohol or drugs, or an interruption of blood supply to the baby. There may be genetic links that cause microcephaly as well. And the final few causes are injuries to a child after birth, causing the brain to stop developing properly, including a stroke, hemorrhage, or other spinal or brain injuries. The most common symptom of microcephaly is the physically smaller head. It is diagnosed both during and after pregnancy. The head will grow as the child grows, but it will always look smaller than normal. Many children with microcephaly have normal intelligence, however, some have learning disabilities that usually do not get worse as the child ages. Other symptoms include balance and coordination problems, developmental delays like delayed sitting, standing, and walking, trouble swallowing, problems with feeding, and there is a possibility of hearing loss, hyperactivity, seizures, a short stature, speech problems, and possible vision problems. There is no cure for microcephaly. A child with mild microcephaly will need regular doctor visits to continue monitoring their growth. Children with severe microcephaly will need lifelong treatment. They may receive medication to control seizures as well as hyperactivity prevention medication and medication to improve nerve and muscle functions depending on the symptoms present. There are treatments called early intervention services that are forms of therapy given early in the child's life. The types of therapies a child with microcephaly may receive include speech therapy to help with speech problems, occupational therapy to help with developmental delays, and physical therapy to help with the child's physical difficulties. To avoid having a child with microcephaly, it is important while you are pregnant to have a healthy diet that includes taking prenatal vitamins, never drink alcohol or take any kind of unapproved drugs, and stay away from any kind of potentially harmful chemicals. Always make sure to wash your hands while you are pregnant to avoid harmful infections and viruses, and always remember to wear insect repellent when going outside during mosquito season. For further support and information about microcephaly, the Foundation for Children with Microcephaly can help tremendously.